Let me say just a few words, and then I will introduce the panel and we'll kick it off. My name is Vijay Gourbaksani. I'm the director of the Center for Digital Transformation at the Paul Merad School of Business right here at UCI. And I've worked for a long time with Paul Feldstein on issues surrounding digital healthcare. And what we're going to talk about this morning is wireless health, whether it's a disruptive innovation or not. So let me ask you a very simple question. How many of you use WhatsApp? A ridiculously small percentage of people. You guys are going to be disrupted because most of you don't use WhatsApp. Let's talk a little bit about WhatsApp. $19 billion Facebook pays for WhatsApp. 450 million users, and you guys are not among them. Pay attention. And 58 employees. Those 58 employees are not that smart. The value of WhatsApp comes from the stuff that me, not you, because you guys don't participate, some of them do participate, contribute to the system. We actually have a Gourbaksani group on WhatsApp because my family is global. It's the only way we can stay in touch. Everything from my niece's new apartment in London to a new baby born in the family, all free. Think about that. If you don't think mobile is real, think again.
You must have listened to the radio this morning.
No, I just follow. Okay, thank you. So now you're thinking, $19 billion is far more than the market cap of most of your companies, I suspect. Now this is where it gets really interesting, and you're thinking to yourself, will I really get disrupted? Think Walmart. 10 years ago, 5 years ago, in business schools, we were raving about Walmart as being the smartest, most tech-savvy retailer out there. Nobody could outdo them in efficiency. Did you see their earnings last quarter? Did you see their revenues last quarter? Foot traffic is down. Guess who's, forgive the colloquialism, who's kicking their butt? Amazon. What does Amazon have that Walmart does not have?
Everything.
Thank you. I knew I could know the everything store for those of you who haven't. Here's what else they have. They have a chief algorithmic officer. Now I want to ask you a question. How many of you in your companies have a chief algorithmic officer? Nobody. Amazing, isn't it? Oh, one. Jeff, I knew I could count on you. I just want you to know that Jeff Margolis is here in the audience just to taunt me, by the way. Or give me a hard time at the end of this. Jeff's on my advisory board, and we welcome his many suggestions into the future of digital healthcare. But seriously, think about this, right? So Walmart is losing to Amazon, and in much the same way that I think many healthcare companies are going to be struggling against the new competitors. And I think a simple way to think about it is, what would Google do? And if Google were to enter your business, what would Google do? Think about the following. I'm purposefully using examples outside healthcare just because healthcare and education, the two sectors that you and I belong to, are the least have shown the least improvement in productivity growth in the last 20 years. And we are ripe for disruption. It is happening to us every single day. We sweat it. Khan Academy, Coursera, Udacity, online education, MOOCs, they're going to destroy our industry. I shouldn't say destroy, they're going to disrupt our industry. The same thing's going to happen to healthcare. But let's think about something else. Who developed the first driverless car? Google. It wasn't BMW, wasn't Chevrolet, wasn't Chrysler, wasn't anybody. It was a software company. The core competency, the skill set moving into the future is going to belong to the people who understand software, who understand data. It's not about the devices, it's about the data. It is the data that drives decision making. And for those of you who think, how many of you saw the Watson thing where Watson beats Ken Jennings, the Jeopardy champion, right? That was child's play. The power of computing is doubling every single year, every 18 months, depending on how you count. So the amount of processing power we are putting on chips is massive. That is enabling enormous improvements in the capabilities of software. So if you think about this field called machine learning, which has been around for a long time, it is growing at leaps and bounds. So every time you turn on Netflix and you watch a movie that it recommends to you, that is coming from a machine learning algorithm. That kind of knowledge base built on the raw data that is collected by all of our devices is going to transform the way healthcare is practiced. Now, one of the good things about healthcare is you have plenty of regulation, plenty of barriers to entry. So one of my predictions would be it's the incumbents who are going to fight it out. It's the new entrants in many cases will be acquired or partner with, because the ecosystem issues in healthcare are very, very complicated. So if you just think about healthcare for a minute, this is, as we all know, so many different players. You guys know more about it than I do, but a lot of different moving parts need to come together. The devices need to integrate, they need to be interoperable, the data needs to come together, and then we need to be able to make decisions based on the data. So when you put it all together, the ecosystem challenges and the regulatory challenges are very, very interesting and quite significant. I work closely with a very large pharmaceutical company, and it's because this is one of the things we haven't talked about as much at this conference, and even they are struggling with how do we demonstrate cost effectiveness, how do we actually change our business model to belong to or to work successfully within kind of the new parameters for healthcare and the Affordable Care Act in particular. But this is, the US is behind in terms of consumer-generated healthcare. Other countries like India, where I grew up, where consumers pay for healthcare even now, don't have the same kind of penetration of insurance. Very, very different business models. So there's a lot of opportunity in the healthcare space. And I think, so last comment, what has really changed? Why are we talking about wireless devices now, and why don't we talk about them as much before? And it's one very simple answer, it's that. So we have never been more connected, where every single sort of person with this, I should say, most people with an income level above a certain threshold have a smartphone. We have more computing, more connectivity in the hands of people than we've ever had before. That is giving us a platform that allows us to put together these wireless devices that will kind of address some of the healthcare challenges that we have in this country. Whenever I kind of feel depressed about the state of healthcare, I go to the Wireless Life Sciences Alliance conference in San Diego, and it's just marvelous to see kind of how much innovation there is in the healthcare space. And sooner or later, one of these things many of these innovations will take hold, and we will see a very, very different future. So I'm particularly optimistic about it. With that, let me turn it over to the panel. So what we're going to do in the panel is we're going to start with Michelle Snyder, who's going to give us an overview of the healthcare, so the wireless healthcare space. And she's filling in for Lisa Sueinen, who unfortunately had a family emergency yesterday and is not going to be able to join us. It's going to be followed by Kabir, and I'll do a more formal introduction a little bit later, but Kabir Kasargod is from Qualcomm Life. As you know, Qualcomm has a big play in the healthcare space, and he's going to be talking about the wireless piece, the device piece, what's going on in the wireless application world. And then we've got Stephen Steinhubel and Einor Sawyer from both practitioners of medicine who are going to represent the provider perspective. So that's our plan for the panel. And with that, let me introduce Michelle. Of course, I've lost my, here we go, thank you. Michelle is the Chief Marketing Officer at WellTalk. You heard from Jeff Margolis yesterday. She's been an investor for several years in the digital health space, was an early executive at Hippocrates and built the company over a decade, leading it to become one of the digital health brands for providers. So with that, let's welcome Michelle. Thank you very much for joining us to the panel. We appreciate all of your attendance.
Sit on. Okay. So I'm very excited to be here, although I have to say I think yesterday I was more excited sitting out there, so I just found out I was doing this presentation yesterday afternoon at the break. So one thing, and the other thing I want to say about yesterday, I was so impressed by Norm's presentation with no PowerPoint, and I thought, how am I going to top this? And I thought the only way I can top this is doing a presentation that I didn't write that isn't mine with PowerPoint. So here we go. So actually, before I get into the slides, one thing I want to say about digital health, I mean, I am so excited and I feel so fortunate to be at this point in time. So I was I was in digital health back in the late 90s when digital health was crazy and not cool as it is today. And I don't know how many of you are familiar with Hippocrates, but we basically had this theory that we could get doctors to use a Palm Pilot with a stylus to look up information, right? Which at that time seemed crazy, and everybody said, why are you going to go work at that company? And the reason I went there was because if you think about mobile technology, it works the way a doctor works, right? A doctor is not sitting at a desk. They're moving. They're going between the hospital. They're going between their office. They're at home. They're looking up information. And so the technology worked the way a doctor works. And so thinking about that, to me, that is the key, right? If you can make something easy and simple to use and works the way the person works and works into their workflow, you will be successful. So we were successful building Hippocrates, but I have to say what's happening today is so much more exciting than what was happening in 1999. So if I had my slides, I usually have this perfect storm slide, and to me, that's what we are in right now, this perfect storm, right? So you have on one side, all these macro events, right? You have the consumerization of healthcare, you have payment reform, you have legislation, you have costs going up, you have this obesity epidemic. So you have those factors going on. Then you have the technology revolution, right? So as Vijay talked about, mobile devices are ubiquitous, right? They're everywhere. There are more cell phones in the world than people today, and the percentage of smartphones is growing, and we're going to be up near 80% within the next year or two. So you take that, you also have cloud computing, so the availability to store data more cheaply and more quickly, and then to analyze that data. We've never seen that before. And then you have social, right? So social is really transforming how we share information, what we share, and it's raising consumers' expectations for what technology should be able to do for them. So given all those things, we're in this perfect storm, and I am very excited. So let's start with some definitions. So when we talk about digital health, and digital health is a bit higher, right, than mobile or wireless health, but people might call it health IT, digital health, M-health, connected health. The one thing I'm excited about, there's no acronym here. You can actually read the word and know what it is, so that's great. But really what it is it's a convergence of many different things. So it's a convergence of digital technologies, mobile connectivity, sensors, social networking, personalization, and then to an increasing degree, I think we'll see over the next few years, genomics. And it's across the whole landscape, right? Delivery, administration, personal health and wellness. And the other beauty to me is everybody in the system benefits from digital health, right? Whether we had to figure out who will pay for some of the digital health technologies, but that's another issue, but at least everybody benefits. And so what you're seeing are B2B models, B2C models, and now the emergence more of the B2B2C model in healthcare. So I'm going to talk a little bit at a high level about investing because I want you to get a sense of the number of companies that are coming into the market and what the implications for that will be. So if you guys knew Lisa, who was supposed to speak, she wears black all the time, so this isn't an apt heading for her. Digital is the new black, but I think she's right on in the sense that digital health is the fastest growing sector of investment over the last couple years. So this is just healthcare investment in general, and you can see it's growing faster. Now, the really interesting thing to me is if you look at a lot of the people who are starting to do the investments in digital health, they were all the VCs that were in med device and biotech because they're realizing that there are a lot of issues in that industry and they're getting pounded on regulation and they're seeing the excitement in the digital health space, so they're moving over. In terms of the amount of funding, you can just see the significant increase here, right? Last year, we ended the year at about $2.8 billion in funding. And a couple of details about this. So of that 2.8, there were 190 different digital health companies that got funded of over $2 million, which is very exciting for this sector. There's a lot that got angel funding, but just almost 200 that got over $2 million. The other interesting thing here, and time will tell whether it's good or bad, is we're starting to see different type of investors. So these are not just healthcare investors. We're seeing more investors that were pure technology investors coming over. So Coastal Ventures and Social and Capital, they probably did the most deals in the digital health sector last year, and they had never done a healthcare deal 2 years prior to that. You're also seeing more corporate investors coming in, and we'll hear from Qualcomm later. I mean, Qualcomm is outpacing everybody, and they've done some really exciting investments, and they invested in us as well, which was very exciting. And they're going to provide a lot of value. The third thing to say too, which I think is good for the investing industry, is 2012 was all about dabbling. You saw a lot of deals being done, but you saw a lot of companies doing one digital health deal. Last year, you saw those same companies re-upping and investing in 2 and 3 and 4 companies, which is actually very good for the sector because it shows that they have a commitment and they're going to be around when those companies need more money in the future. So where's the money going? If you guys don't know about Rock Health, you should go to their website. They're one of the leading digital health incubators. And they've done a great job kind of building the market for digital health companies. But one thing they do really well too is put out reports. So they do annual and mid-year funding reports on digital health. And so I've taken some of the information, or Lisa's taken some of the information. So there are 6 major areas where 50% of the funding went into EHR and clinical workflow, analytics and big data, digital medical devices, wearables, population health management, and healthcare consumer engagement. And the numbers are a little bit misleading in the sense of, right, EHR here, Practice Fusion raised $80 million last year, right? So 1/3 of that chunk is Practice Fusion. Down here in population health management, a big chunk of this was Evolent. So you have some big players that are making up a lot of the investment. But what's exciting to me is just seeing all the different areas that are getting funding. The 2 I wanted to talk a little bit about are just the wearables and biosensing. So I actually did not wear, I did not wear my Fitbit today, but that from an investor perspective, that's been one of the most interesting sectors because James Park, who's the CEO of Fitbit, will tell you, and he's spoken about this, he went to 80 different venture capitalists to get money for Fitbit, and nobody invested in him. He had to go get money from friends and family, and everybody said this is a fad, only the quantified self people who are real, want to track everything they do will wear Fitbits. And I was even skeptical till last year, and then what turned me was, I'm from Milwaukee, and the rest of my family is in Arkansas. So I live in San Francisco, so it's like going from night and day when I go visit my family. And I went home and I saw my 65-year-old mother wearing a Fitbit, and I did not even tell her about Fitbit. And she was out walking with all her friends, and they were comparing their scores and talking about their activity. And I never saw my mom walk that much ever. And so that's when the light bulb went off for me. And unfortunately for a lot of investors, the light bulb went off a little too late because now Fitbit probably doesn't need any more money after their last round and is going to make all their angel investors a lot of money. But I think that's an area that's going to continue to grow. Just personally, the other area I think is really exciting are digital medical devices, right? And there is a spectrum there. So you're going from something like a Proteus. I don't know how many of you have heard of Proteus, right? But it's basically a sensor that goes on a pill. So when somebody ingests it, you can tell that they've taken their medication or not, right? So think about that versus these little pill boxes that you get your parents to use, right? And, I don't know what will happen with Proteus, and I think there are going to be some issues with adoption, but the fact that that's what we're moving to, or that's what we're at least thinking about, is very exciting. And other things too, right? Propeller Health, where you're putting a GPS sensor on an inhaler so that you can track where people are using their inhaler and that information gets sent back to the doctor. Very exciting. So why is digital health so hot? So Lisa has her list here, which I, for the most part agree with. I think on the first bullet, to me, it's not just having inexpensive technology, but it's having technology that's already in people's hands, right? So as Vijay talked about, I carry this thing with me everywhere, right? If I forget my phone, I feel lost. I use this to figure out where to eat. I use this to listen to music when I run. This is now my camera. I don't even take my camera anymore anywhere. And so that to me is the thing, is a technology that's already in people's hands so that you don't have to deal with that barrier. You just have to then get them to adopt what your application is. I think on the democratization of data, I think what's exciting to me is not just having the data, but now we're getting to the point where we're able to turn the data into insights and something that people can really do, because I don't think data on its own is very valuable, and I think that's where we've been for the last couple years, but I feel like we're starting to see a shift now. The rise of the sensors, I agree with that, it's very hot, but to me, what that really signifies is we're moving from this kind of needing to be active to being passive, right? We know people have been pretty passive and are pretty passive about their health. And so the only people that were really tracking things were people that were logging in books, right, and writing things down. With these sensors, you don't have to do that at all, right? I forget this is on my wrist and it's tracking, in the past it's just been tracking steps, but with now some of the new technologies, it's gonna track heart rate, hydration, and other things that you didn't even know about yourself, which is very exciting. So one thing, Vijay talked about on the consumer side, companies jumping into the digital healthcare space, and so it's interesting, right? Because I've been in healthcare over 20 years, and I think one of the arguments we always make in healthcare is that, when you hear about a company like Apple or Google coming into healthcare, I think a lot of us are guilty of saying, well, healthcare is so complex. How could they possibly know anything about healthcare, right? And they're not going to be successful. They might not know anything about healthcare, but they know about software, which is what Vijay talked about, and they know about how to engage consumers, right? We in the healthcare system do not understand that. We do not know how to delight people. We do not know how to create fun and create an engaging experience. And so whether or not many of these initiatives will be successful, I don't know, but I think we on the healthcare side should be looking very closely at what these organizations are doing and learn from them and take some of those nuggets back into the healthcare system. So I was just going to point out a few things. Some of the names you might be surprised at. So L'Oreal, that was one that I was surprised at. They actually have a whole digital health innovation lab in L'Oreal that is working on clothing that measures your hydration to tell you what sunscreen you should use, right? I mean, it's wild, right, the things that they're thinking about. And then Apple, some of you might have been watching, they're talking about the iWatch, right? And initially the iWatch is going to track your steps, but then what they're talking about is hydration and heart rate and glucose monitoring, right, and other things. So I'll just leave it at that, but I think we in healthcare have to be careful to dismiss some of these players who are coming in and realize that we can learn a lot from them. So I didn't even know what this, I had to go to the internet. I guess this is Icarus, right? So Lisa, I have to talk to Lisa about this picture. But anyway, so I'm very, very bullish on the sector. There are some obstacles, right? And I think Lisa's laid some of them out there. To me, the ones that jump out are that your workflow, right? That was one of the challenges at Hippocrates, right? You can have a great product that works, but it has to be super easy to use and fit into a clinician's workflow, or they are not going to adopt it. I will tell you that straight away. Reimbursement, right? Who is going to pay? There are so many interesting technologies out there. One of my favorites is my friend who started a company, CellScope. And as a mom, right, the most frustrating thing is, well, one, I don't like my son to get sick, right? But when he gets sick, I have to take off of work. I have to go sit in the pediatrician's office for 2 hours because I didn't have an appointment. I'm getting all these other children sick because of him. And CellScope basically puts an otoscope on the cell phone. So as a mom, my son is sick. I take a picture of his ear, I send it to the physician, they can tell if it's an ear infection or not immediately, they can call in a prescription to the pharmacy and I can go pick it up. I don't have to take off work, my son is happier because he's not sitting into the office, right? And so as a consumer, that is how I want healthcare to be, right? I don't think the system's ready for that, but the challenge is going to be who is going to pay for that, right? I actually probably would pay for that as a consumer because my time is valuable, but would the general population pay for that? I want to talk about the last one, Bubble, because I think that is going to be really interesting. So this past year has been exciting in digital health. 2 companies have done an IPO, Viva and Benefit Focus. They're SaaS companies, and together their values are about $5 billion market capitalization. I mean, that has been great for the sector. There's a third company that just filed an IPO, Castlight Health, which some of you guys might be familiar with. It's a healthcare information transparency company, and there's a lot of talk on the internet about that company right now, just given their financials and when they filed. And everyone in digital health on the investing side hopes they are going to be successful because that will be good for the whole industry. But if they're not, it will be really interesting to see how that affects the whole digital healthcare space. So the last slide is mine. I made this one. I got to sneak it in this morning. So here are my predictions. So I talked about sensors a bit. So I think we're going to continue to see exponential growth in this sector. And then it's going to be so interesting to see what we're able to do with that data and how we're able to integrate it. I talked about this a little bit, moving from data to actionable insights, and I think Vijay talked a little bit about cognitive computing too. So we're really on this third wave of computing, right? We started off with kind of tabulating computing, then we moved to programming, and now we're in cognitive computing where we can leverage natural language processing to, think in a way that a human thinks. And the beauty about cognitive computing is it gets smarter all the time with every interaction with a consumer. So if you can imagine, right, having an application that, has your claims information, understands your health status, knows what you like to do, knows what restaurants you like to do, and is constantly learning from your activities and giving you recommendations on how you can be healthier. That to me is something that I think we're going to see in the next couple years that's really exciting. And, Watson is out there leading the charge in cognitive computing, but there are other companies as well. Vijay talked a little bit about this platform as a service model. So on one hand, it's really exciting. There are all these early stage companies out there in digital health. And I don't know if you guys have been to Startup Health website. They have a database. There's 5,700 digital health early stage companies they are tracking, right? So on one hand, that's great. On the other hand, most of those companies are not going to survive, and most of those companies are not companies, they're products, right? And so what we're going to start to see is the rise of the platform in healthcare, because I think what population health managers want and what consumers want is to solve this chaos problem, right? It's great we have all this technology, but we want one place to access all that information, and we have one place to go to tell us what to do with all of that information. Incentive-driven healthcare. So I think this is one thing we can learn from other industries, right? Think about, I flew down here on United. I hate United Airlines so much. They don't have Wi-Fi, this and that, but I'm a frequent flyer, and I get to board early, and I get to go in the TSA pre-check, and I keep flying them, right? But as soon as I hit 50,000, I go to Virgin. But anyway, I do get those benefits, but the fact is incentives drive behavior among people. And as consumers are having to take more responsibility for their health care, they're going to want to be incented and rewarded just the way they do in other aspects of their life. So I think we're going to see more focus from companies on incentive design and reward management. And I'll just end with telehealth and remote monitoring. I talked a little bit about some of the companies that I was excited about, but I think given some of the trends we have, higher costs, provider shortages, and consumer demand for a healthcare system that works for them, not for the provider, I think we are going to see a more rapid increase in this space. So, thank you.